If you're a nursing or pre-nursing student and you know you need a better way to study to get higher exam grades, improve your clinical judgment, and become the best nurse you know you're capable of being, you're in the right place. Over the next 10 minutes, I'm going to give you the full overview for the entire 4-step method of the Silver Bullet study system. This is the method that I've developed over my past 16 years as a professional nursing tutor working with nursing students just like you. This method is going to show you how to always identify the most important information. It's going to move you away from memorization and towards learning how to connect the dots for yourself. And you're not going to have to read your textbook word for word anymore either. If we haven't met already, my name is Nurse Nicole. I'm the founder of YourNursingTutor.com, and I specialize in helping you get comfortably passing grades, learn to think like a nurse, and to do it all while living your life comfortably and not getting burnt out while still in nursing school. If you want a copy of the chart that goes along with this video that includes all 4 steps with explanations and the question you need to be asking yourself on each step, I'll include a link in the show notes so that you can request one for yourself for free. But the first thing you need to understand about the Silver Bullet study system that makes it different from any way you've ever tried to study before is it's not just a fancy way to take notes. It's a whole new way of thinking that's going to have you thinking like a nurse in no time. So here's how to get started. Step 1, I call the foundational 15. This is the best way to solve that problem of not knowing what the most important information is. Because from now on, you can identify the most important information, even if you're a brand new nursing student who has never had a day of healthcare experience in your life. And you do it by asking a simple question. You ask, what do I need to know about normal before I can begin to understand this topic I want to study? Now, even though we're moving away from memorization, step 1 and 2 are the steps where most of our memorization is still going to happen. But now, instead of having an overwhelming amount of information, we're going to be focused on the right sorts of things to memorize instead of just trying to memorize everything. For example, let's say we were going to study respiratory disorders. Let's pick pneumonia. We say, what do I need to know about normal before I can begin to understand pneumonia? One thing you'd have to know is the normal anatomy and physiology of the respiratory system. If you were studying an electrolyte imbalance like hyperkalemia or hypokalemia, you'd have to know something like what's the normal lab ranges for potassium? What does potassium do in the body? I call this step the foundational 15 because I recommend setting a timer for 15 minutes while you do it. That's because even though it's essential to review this stuff, we don't want to spend all of our study time reviewing normal. We do need to be moving on to the information that's explicitly being tested on our next exam too. And since you only have 15 minutes, don't be a perfectionist about this. Less is more. Don't be afraid to forget important information because there is a series of checks and balances built into the Silver Bullet study system. If you miss something, you're going to be able to notice in steps 2, 3, and 4 and go back and add it in later. That's part of the beauty of this process and how it builds your confidence. On to step 2, which is the Humpty Dumpty factor. Because Humpty Dumpty sat on the wall, Humpty Dumpty had a great fall, and now he's broken. In step 2, you ask yourself, based on what I know about normal, what has broken or changed for this topic? If you're studying a disease process, this is usually pretty straightforward because it's going to be the pathophysiology. But if you're studying for a class like pharmacology or nursing fundamentals, we apply it a little bit differently. Learning to adapt the Silver Bullet study system to your particular classes and your particular learning style is a big part of what I help with in my Study Like a Nurse tutoring community. But what's important for step 2 is that you have to describe what has broken or changed in one single sentence. You also want to use everyday words that like a 4th grader would use. Not only will you understand it better this way because it's an active learning strategy, but your future patients are going to thank you for it. Because when the doctor walks out of their room and they've been bobbleheading because they're sick, they don't feel good, and they don't understand a word of that medical jargon he was saying to them, you're going to be the nurse that walks in and explains it in a way that finally makes them feel better and makes them feel like they understand what's going on. And they will remember you forever for that. Now we're at step 3, which is what I call crystal ball prediction. This is the spot where you switch from phase 1 studying, which is still a lot of memorization, to phase 2 studying, which is practicing how to think like a nurse. But we're going to do it with training wheels to make it easier. The question you ask yourself in step 3 is, based on what I know about normal, based on what has broken or changed, what do I predict is going to happen next? Then you just start making predictions. For example, if we were going to go back to pneumonia, we know we need to know the normal respiratory system for pneumonia in step 1. Step 2, pneumonia is inflammation of the lungs. So if you know in step 1 that lungs are supposed to help you breathe, and you know in step 2 that they are now inflamed, which is going to interfere with how well they do their job, then in step 3, I'm sure even if you're a beginner nursing student, you can predict that they're going to have difficulty breathing if you have pneumonia. When you study this way, it's really not rocket science because this is where the real magic of this study system works. I guarantee that even if you have never studied these disease processes before, you can still make accurate predictions just by studying step 1 and 2 first. Some of y'all are making studying for nursing school way too complicated, and it's okay. I work with overthinking nursing students all the time. Tell me in the comments if you're an overthinker and how bad your overthinking problem is. Now, the one key to step 3 is you have to use the magic word. What is the magic word, you ask? The magic word is because. So you're not allowed to simply write something down because you remember your instructor saying it or you read it in the textbook. You can only write it down as a prediction if you say, I predict this will happen because, and then explain why. I predict this patient will have difficulty breathing because the lungs are inflamed, and that interferes with its ability to do its job of breathing. Once you've practiced making a few predictions on your own, now you want to go back and check your answers. Look it up in a textbook, check your PowerPoint slides, Google it. I don't care. Whatever resource works best for your brain is the one you can use. Remember how I promised that this system has built-in checks and balances, so if you forgot anything from step 1, you'll catch yourself later on? Well, this is one of the ways you can catch yourself. When you check your answers, you might say, oh, crackles can happen in pneumonia, and I don't know what crackles are. Well, even though crackles are abnormal when they happen, they do have a normal definition. And so you would go back to step 1, add the definition of crackles and what they sound like so you know how to recognize them if you ever hear them. And then you jump back to step 3 and you move on with your day. Now, here's the absolute most important thing you always have to remember about step 3. You only remember one thing about the Silver Bullet study system. Let it be this. You must take the time to make predictions for yourself. Think things through between step 1, 2, and 3 and use your magic word because. Do not just copy symptoms out of your textbook or because you remembered it from somewhere. If you do that, you're just memorizing again. And if you try to memorize the step 3 information that you should be understanding, you're not going to improve in nursing school and the Silver Bullet study system is not going to work for you. But it's not because the Silver Bullet study system doesn't work. It's because you're not actually doing the Silver Bullet study system if you do it that way. You're still trying to memorize everything. The making predictions part is absolutely key because that's what gives you practice developing your clinical judgment. And I promise, if you do this process consistently over time in nursing school, you're going to find that nursing school gets easier as you progress instead of harder, like it's happening to your classmates. Your grades are going to take care of themselves until you're getting comfortably passing grades with no problems. And you'll be feeling more and more confident as you go. Until one day you wake up and you realize you went to bed on time last night and you still feel totally calm and prepared for your exam today. Now on to step 4, which I call finally nursing care. Because y'all thought you came to nursing school to learn the nursing care, but that's actually the last thing that you learn. And for good reason, because nursing care is like an iceberg. Have you ever heard the statistic that only 10% of an iceberg is visible above the water? The remaining 90% is submerged under the water. You can't even see it. That's why if you struggle with prioritization questions in nursing school, it's not because you need a better test-taking strategy. It's because you're missing a big chunk of that 90% that's under the water. The same is true if you struggle with select all that apply questions, or if you can narrow down the answer choices to 2, and then you always pick the wrong one. And nobody's ever told you this before. Luckily, steps 1, 2, and 3 of the Silver Bullet study system are that 90% that's under the water. Now, the way we approach step 4 is basically the same way we approach step 3. Here's the question you ask. Based on what I know about normal, based on what has broken or changed, based on what happened as a result, what are we going to do about it now? And then you don't just copy out of the textbook. You don't just write things you remember. You pause and you make predictions based on what you know about the previous steps. What kind of nursing care and medical care do we expect to be happening in this situation? And once you've made your predictions, then you go back and you check your favorite resource to see if your predictions were correct and what additional information you need to add. Make sure you don't forget to use your magic word because for every prediction. By the way, have I mentioned yet that this is the reason why I tell nursing students you do not have to read your textbook in nursing school? Because with the Silver Bullet study system, we can read our textbooks like a dictionary, not like a novel. You would never sit down, open up a dictionary and say, I'm going to read about the letter B today. No, and you don't need to read your textbook that way either. When you open up a dictionary, you have a question in mind. And the question is, how do I spell this word, or what is the definition of this word? Then you look up the answer to your question and you close the dictionary. It can be the same way with your textbook. I guarantee that if you follow these 4 steps of the Silver Bullet study system correctly, your exam grades will improve. You're going to feel more relaxed and confident. And most importantly of all, you're going to learn to think like a nurse. If you've still got questions about the Silver Bullet study system that I haven't answered in this video, leave them in the comments if you're watching this video in a place where you can do that, because I will try to help you out if I can. And like I mentioned, I do offer private tutoring if you want it. And I also have my Study Like a Nurse tutoring community, which is that hybrid tutoring model that's less expensive than private tutoring. I know nursing school can be overwhelming, but when you study this way, it can become a breeze. And don't forget, if you want a copy of this overview for the Silver Bullet study system, make sure to check the link in the show notes. In the meantime, if you want help with dosage calculation, maybe you have some extreme math anxiety, then you're going to want to head over here to this video next. But if you're already a dosage calculation master, then this video over here is going to be your next step. Either way, here's to your nursing school success, and I'll see you in the next video.